You're listening to an archived Cabral Concept podcast. After listening to this show, check out the most up-to-date podcasts available at stephencabral.com/podcasts or search directly on iTunes. And now, welcome to the Cabral Concept, where board-certified naturopath and integrative health practitioner Dr. Stephen Cabral shares how he was diagnosed at the age of 17 with a life-altering illness and given no hope for recovery. It was only after studying and traveling all over the world did he discover how to combine ancient Ayurvedic healing practices with state-of-the-art naturopathic and functional medicine to fully rebalance the body and re-energize it with life. It's time to discover how to get well, lose weight, and finally feel alive again. And now, here's your host, Dr. Stephen Cabral.
I appreciate you tuning in. Today we're going to be covering a very sensitive topic, but one that we absolutely cannot ignore. So I want to speak directly to either you or one of the loved ones in your family currently dealing with depression or schizophrenia or anxiety or social emotional based issues, interactions with other adults or children as well. This can affect any type of PTSD or trauma. So I want to talk about those things, but I also want to, and how it relates to our overall wellness. So there's a lot of people out there right now, and I'm going to get into this, with digestive-based issues. And those digestive issues never seem to go away, no matter what any practitioner does for them. And when this happens, we need to begin to understand that how our mind affects our emotions and affects our physiology. I'll say that a lot today. Physiology just being how our body works. They're all interconnected. And so if you are dealing with, it could even be headaches or really low energy or pain. It could be from previous trauma, anxiety, PTSD, something that you're experiencing now in the physical part of the body as well. Or if you're experiencing, of course, depression, low mood. At a chronic level, that means that it's been more than 4 weeks, 6 weeks dealing with this issue. So, and I want to be really honest with you today. I really do. Part of the Cabral concept is, I think it's somewhat therapeutic even for myself. I mean, I really believe that. Although my main goal is to help people all around the world really find the root cause. I mean, that's the bottom line, is that we're not trying to diagnose you with anything. Most likely you already have half a dozen different diagnoses, right? Or it's a mystery-based illness, an idiopathic dis-ease of the body. So what I'm looking to do right now is help you each and every show figure out what is the underlying root cause of something you're dealing with, or if you're a health coach, doctor, health practitioner, personal trainer, etc., how can you help those that you work with? That's what this is all about. And there's quite a few therapists that also listen to the show. So what I want you to understand is that, you know, being a therapist, a psychologist, a psychiatrist, anyone, I mean, an NLP coach, a hypnotherapist, I don't discriminate at all. Anybody trying to serve others and help others is great by me. I mean, I just think it's the best career that you could be in, any type of the health and wellness-based sphere, because we're all trying to help each other for sure. And many people get into this field due to an issue that they had, and that's no different than myself. More than 20 years ago, I was extremely sick. Much of that was mental, emotional. There's no doubt about it. And then there was a physiological component to that. So mine was physiological. Too much work, too much stress from schoolwork, too many sports, working a job at the same time, and then also 3 years of daily antibiotic use, over 3,000 capsules swallowed before the age of 17. So that's the physiological part. But then I had a mental, emotional-based issues with basically how I saw myself as a child, how I grew up. And what I want you to understand is that it's multifactorial, right? So when people aren't well and they want to lose the weight or whatever it might be, I always let people know, if there was a silver bullet, then everybody would figure it out really easy. But there's usually many facets to getting well. There are layers, which is why we have the de-stress protocol: diet, exercise, stress reduction, toxin removal, rest, which is the parasympathetic. We're going to be talking about that today. Emotional-based balance, supplement protocols to help push the body back into balance, and then, of course, success mindset. So the de-stress protocol, when we look at those 8 parts, well, 2 of them are mental, emotional, and that's extremely important. That's what we want to talk about today. So what I want to do is introduce you to something you may not have heard of before. It's something I've been studying over the last couple months quite in depth, really trying to figure out, how do I help? And this is where I want to get honest with you. There's about 4 people in my practice that I've been working with that aren't getting the end result that we want. So they've made great progress, but great progress is great, right? So they're doing much better in life. But my goal is to help everyone get well, everyone to achieve their goals. That's my end result. That's why I still continue to practice. That's what pushes me to this day. And that's what we do. I mean, I tell people all the time, listen, the only way you're not getting well is if either one of us gives up. And I'm not willing to give up. So unless you give up, we're going to figure this out. It might take some time. Typically, like I say, most people, 12 to 16 weeks. It really is. You'll see tremendous differences, if not everything that you need. Some people will take longer. I'll just give you the 4 cases that I'm dealing with, and every practitioner has their own cases. And so these 4 people, I need to explore at a deeper level. There's no doubt about it that there's a stress component. That's why these 4 people, I can't help them get over the stress component. But what I can do as a doctor, as a practitioner, is to show them different ways to go about this, explore different ways, let them understand that they're not alone and it's not just them. It's not trying to mentally get over it. You can't just get over it. That's not how it works, right? And that's very condescending to people that are sick. You just need to get over it, especially with mental, emotional based issues, especially when it has to do with depression or schizophrenia or any type of trauma, PTSD. You can't just get over it. And that's because there's a physiological component to it. And that's what I want to explore today. So if you're a therapist out there and you are doing some type of talk analysis, psychoanalysis, NLP, etc., you have to look at this as also physiological. Because what I want to do is I want to share the 4 people right now, and then I'm going to go deep into this. So I have one person still having digestive-based issues. And I can show them, listen, like we now call it the Candida metabolism and vitamins test, also called the organic acids test, and I can show them other labs and I can say, listen, you're well, like your before and after, it's good, you're clean there. Or they are clean and they come off for a little while and they relapse again. Well, that can be because of poor peristaltic movement, which again is connected to this thing called the vagus-based nerve, or the vagus nerve it's called. And so I want to talk about that. Another person I have has a very accelerated or high heart rate. So that high heart rate just won't come down. We've got it now. They're on medication, but again, that's part of it, but we still need to work on it. So their resting heart rate is in the 90s. And I can't have that, right? Because that's not going to allow them to be more calm, to not have that anxiety. So I need to help them with that, and I'm doing everything that I can, but I always can do more. And that's why people ask me all the time, why do you continue to read? Why do you continue to research? Like, you don't need to be doing that. Well, the truth is that I need to be doing that for the 4 people right now. That's what I need to be doing it for. And so when I committed myself to this field many years ago, it was not to help just those people that it was easy. It's to help those people that have never found their answers. So I'm committed to that. And it's a great process to go through because in the process, you're always thinking about, I'm thinking about those people. Like, how can I help them? Because they're the outliers. And if I don't help them, who's going to help them, right? They're just going to move on to the next practitioner, which is okay with me. That's okay with me too. I just want them to get their end result, their end goals. But, what I want to do is I want to help that person with the digestive issues that's unresponsive to a lot of other things, or they get well and then they relapse when they're off it. Okay, here's why. And then also the person with the accelerated heart rate, one more person with infertility, with fertility-based issues. So those 3 people are female. And the last person is male with really high levels of anxiety. And I know personally, I've been doing this a long time. And because I was so sick for so long, I am able to read people at a deeper emotional level. I feel that I know why they are not well. And many things they've shared with me as well in confidence that I would never break that confidence. But the truth is this, that they are so stressed from a deeper trauma that happened earlier in their life that it's essentially repressed, that it's deep locked down. And that is where this polyvagal nerve theory comes in. So what I want to share with you is that today, because this is going to help those people that may never be, they just are not recovering. And that is when the brain signals to the rest of the nervous system, the rest of the body, that something traumatic happened. And here's how it works. This work is based on Dr. Stephen Porges' work. Okay, I can link up a book if you'd like today. Why don't we do this? Head on over to stephencabral.com/1425, and I will share with you Dr. Porges' work. Okay, so here's what you want to understand. And I've talked about the autonomic nervous system at length. I talk about it in depth in the Integrative Health Practitioner Institute. So these are things that we can certainly teach you more in depth, but I want you to know within this 22-minute podcast how to begin to heal and what to look for, right? It's a starting place. It's what we need to do. So our autonomic nervous system, you can think of it as the autonomic nervous system. It's what allows your heart to beat and allows you to breathe without really thinking about it. So you don't tell your heart to beat, it does it automatically. You don't tell your eyes to retain moisture, they do it automatically, and hopefully at the right amounts. But that's where it starts. Okay, so the autonomic nervous system, part of the central nervous system, part of the peripheral nervous system, which experiences stress or relaxation in life. Well, it branches then into what's called the sympathetic nervous system and the parasympathetic nervous system. So the sympathetic nervous system, you probably heard about me speak about before, which is the fight or flight. So fight or flight is when we're under stress. So when we're under stress, now the bad stress would be we signal and we feel danger. We're uncomfortable doing something. It could be getting ready for a meeting or public speaking. It could be stress with taking a test. It could be stress with potentially getting bad news, any of those things, okay? So that's what we call the yellow zone. So the green zone is relaxed, right? So the green zone's relaxed, that's play. The yellow zone is sensing danger. So, and we developed this millions of years ago as the human species, and we're actually made up, if you look back, made up of different species, but we'll get to that in a second, why that matters. So we look at that, we have a green zone that we want to stay in. That's the parasympathetic nervous system. We're relaxed. We use it for rest, for rejuvenation, for rebuilding the body. Rest, relax, digest. That's mainly how we're using it, and hopefully we stay in that. And then we can move back and forth to the fight or flight, the yellow zone, where we start to experience a little bit of accelerated heart rate. Blood pressure can increase a little bit. Now we can experience that by playing sports. That's not a bad way to experience it, by dancing, by exhilaration. Okay, that moves us into that zone too. Not that it's danger, but we start to get into that higher heart rate and stimulating the body. But again, we're more on the parasympathetic side there. Now, the sympathetic side, again, is that fight or flight. You sense danger. And we all know this. This is built in. This is, again, part of that autonomic nervous system. How do you sense it? Well, when someone walks into a room, you are automatically sensing that person. It is way more than just the conscious mind. We have to understand that. It is the nervous system, which has its own brain, we call it the gut-brain axis, the vagus nerve. You are sensing your environment. You know when someone is approaching you, whether they mean harm, danger, or they're okay. And we look at that. We look for cues right away. What does the face look like? Is it expressionless? They call it flat-faced. And that means there's no expression. It's just basically flat, solid. That's it. There's no smile. There's no downward turn. It's almost no emotion. And that's a danger sign. That is a danger sign to look for. So we sense that. And what happens is there's actually changes to our pupils. We begin to get dilated pupils, okay? So that allows us then to start taking in more light. And believe it or not, our auditory senses change. This is extremely important because if you are someone that does not do well in crowded places or with a lot of noise, it is possible you're dealing with some type of post-trauma or in a burnout state of too much fight or flight. And that's because when you are in this fight or flight based state, it allows you to start picking up more of these danger based noises. Call it mid-auditory based zone. I'm not going to get too deep today. You're welcome to go into this research yourself if it's interesting for you. Okay, so most of us know that. So we have a rest zone, we'll call it the parasympathetic, and then we have what's called the sympathetic, which is the fight or flight, realizing danger. And I'm not going to go in depth with the adrenals today. We've spoken about that before with how your body produces stress hormones such as norepinephrine, adrenaline, cortisol. Okay, so we've talked about those. That's how the body responds. But there's another level to this that most of us, including myself before just a little while ago, was not as familiar. Now it's called the polyvagal nerve theory. And it's still a theory right now, but it does take place. We just don't know if it's a separate branch of the nervous system or part of the sympathetic nervous system. So it falls under the sympathetic nervous system because it's the red zone. So green, we see safety. We're having fun. We're laughing with friends. We're enjoying a meal. It's all of the blue zone activities, right? Going for a walk, meditating, being outdoors, hugging your kids, like any of those things. That's the green, okay? The yellow is something's going on here. Something doesn't feel quite right. You're in a nervous-based situation. And it could be anything stressful. Again, test taking, giving a presentation at work, anything nervous-based, okay? So we're in the fight or flight. Understood. Okay. So we've got that. Now, what happens with the vagus nerve when we call it polyvagal, meaning more than one? Well, The parasympathetic nervous system allows for that relaxation. It actually allows the pupils to constrict. It allows for the blood flow to move to the surface of the body instead of pulled to the core and the limbs. So there's one more part to it, though. And this is really interesting because it's the freeze part of fight, flight, and freeze. This is where, for me, it gets extremely interesting because I'm a huge researcher of the nervous system. It's something I've gone quite in depth with, and I find it very, very interesting. And I still believe this. Again, it's not here yet, but I still believe energy, frequency, sound, light, vibration is how we are going to be able to heal people at a much faster degree in the future. I don't know how we're going to be doing it yet. I know that there's all sorts of things out there right now, and I'm studying them, I'm looking at them, but it's not there yet. But frequency, hertz, I believe this holds the power to deeper healing. And I see what they're using it right now on cancer cells. I see in a lab how they are actually killing cancer cells with multiple frequencies at the same time. You can look it up if you want. That's not what today's podcast is all about. But the thing is this, we're in the wrong entrainment. So what happens is our nervous system shut down at some point. If you're dealing with PTSD, anxiety, potentially depression, schizophrenia, any of these things, it's at least worth looking into. Because what we find is that the freeze is well beyond the sympathetic nervous system fight or flight. Freeze is actually now pulled into the parasympathetic. And I want to explain why. So this was a little confusing to me because parasympathetic is always considered the rest, relax, and digest. But there's one more part to it. Because when your life is threatened, and I mean really threatened, meaning like you believe you are going to die. And now again, it could be any situation. It's subjective. So everyone has their own reason of they feel this is a life-threatening situation. And again, it could have gone way back into childhood of some type of scary moment, traumatic moment. And again, we can all think of maybe one that we experienced, or again, hopefully not everyone can relate to that. But this is where we begin to disassociate, kind of move from outside of ourselves. Some people may faint, some people might go into shock, but what happens is there is a place where the body actually pulls away. We become immobilized. We literally freeze. We don't necessarily feel pain either. It is the body's way of protecting us at death or a life-threatening based situation. You essentially go numb. And we hear a lot of people talk about this. One of the reasons I wanted to bring this up, and one of the reasons why it's such a sensitive topic, and maybe you can't hear it in my voice, and I want to be sensitive around this, is that we have a lot of people out there right now. A lot of women and some men as well. There's no doubt about it. Men are a part of this too. And I think that more men should be talking about this, but it's, not considered macho or whatever it might be. But there's a lot of people walking around who are true victims, and they are not looked at as such, and their cases are not heard. So for one example, with physical abuse, mental, emotional, physical, sexual, etc., if someone doesn't try to put up a fight or push back, they say, well, you didn't do anything to try to prevent it. Well, in that moment, that person may have gone into what's called a deep immobilization, a disassociation, where the body literally froze. And they were not able to do anything. It was not their choice. They didn't get a choice. Their nervous system shifted them there. Remember, it's automatic. The autonomic nervous system shifted them in that position so that they could do their best to either survive, and I'll get to how that happens in just a second, or to block, to disassociate, or feel no pain during an event that may take their life. And that's the seriousness of this. And that's why we need to begin to really look at how we view people that are true victims in this world. But not just keep them as a victim, because remember, I don't want somebody believing and feeling that they're a victim the rest of their life. I don't want this to affect them the rest of their life. We need to move on. The event happened, but I can't have you carry that with you for the rest of your life, because you're not going to be able to fulfill your purpose in life. You are not. And your passion. And you have most likely a whole lot more potential. And so I don't want you, or again, if this can help any of your loved ones, pass it on to them as well. So it's also why, though, as therapists, as a talk-based therapist, you want to begin to look at actually working on the physiological part of the body, because this is locked into the cells of the body. This is locked into the nervous system. It affects the entire body. So where did this come from? How did this happen? Well, if you think about it, when an animal is caught in the wild, like let's say a lion is chasing after a gazelle. If it catches the gazelle, even though it's possible for it to fight back, it actually just lies there. And it's in this freeze-based position. That is a true example of immobilization. It will just kind of look out there with those, as I say, deer in a headlight-based eyes. But where the human species comes from in this polyvagal nerve and this freeze is actually from the old reptilian-based ancestry, if we look at that. And if we look at that, it's the same setup. When you even see a reptile in a pet store, it just is standing there. It's just staring there. It's in constant immobilization from all of the light and from people basically just staring at it. So if you see a lizard, typically, like we'll go to Florida, we'll go to Hawaii, and there'll be little, geckos and lizards and chameleons. And when they see a person, they actually freeze. They freeze in order for them, hopefully, to not be seen. And if they are, well, they're in that disassociated base state. So it's a protective base state as well. Why this matters is that we have to begin to look at our nervous system as truly linked to previous trauma. That means if we want to heal at the deepest level possible, we need to start working on releasing, because that's the best word for this, is to release that previously stored trauma. And it is stored, not just in our brain. It's not. I honestly believe that a lot of great techniques work. Cognitive behavioral therapy, CBT can work for people. NLP can be amazing if you work with a great practitioner. There's great techniques to use, and you should use them. But you need to do it in conjunction with also letting the body know that it's in a safe space. And people always say, well, how do I overcome this? Well, it's not instantaneous, okay? So I don't want you to believe that. We can change in an instant, but it's not always that simple. So the reason why I wanted to add that we can change in an instant is because you can. You can change in an instant with a really qualified practitioner and someone that's working on the nervous system as well as the body, meaning like the mind and the body together. Okay, so we're talking through it, we're working on it. We see this sometimes with great practitioners of the emotional freedom technique. We see it with cross crawl patterns from left to right across the body. I could go on, but one of the best ways that we know to do this is actually to control our breathing. So most people who are anxious are not good at controlling their breathing. They take shallow breaths or they're holding their breath, which is only to a greater degree putting them more in that fight or flight. And they are taking shallow breaths in the lungs, which means they're not in the lower lobes. And their exhale is actually shorter than their inhale, which again puts them in an excitatory state. If you're in an excitatory state, where are you not? In the parasympathetic. If you're not in the parasympathetic, you're going to have digestive issues? Yes. If you're not in the parasympathetic nervous system, are you going to be nervous? Yes. You're going to have anxiety most likely. You're going to be worried. If you're not in the parasympathetic nervous system, which is the rest and relax, and you're in the fight or flight, is your body telling you that you're in a safe space to have a child, to bring a child into this world? No, you're not. And one more. If you are in a fight or flight-based space, will your heart rate be accelerated? And the answer is yes. You have more adrenaline, norepinephrine running through your body. So what we need to do, and for those 4 people that I have in my practice, I need to come up with better cues. I need to come up with better ways to help them with this. And again, most people are looking, is it heavy metal? Is it this? And I just say, listen, we went through that. You're good with that. We've explored that, and it's what works for 99+% of people. You're just one of the people who needs to work a little bit more on telling the body that it's in a safe space. And you could do that. And it's a great journey to go through. I did it myself. I did. That's why I want to be sensitive around this, because I know that for me, one of the final phases of healing was getting into that parasympathetic, was to let go, to release a lot of this trauma and anxiety and nervousness and all of those things that didn't seem that way on the outside. They were always about probably overdoing it in terms of confidence and outgoing, where it wasn't real. It was me trying to compensate maybe for things where I felt like I had maybe some fragility there as well. So we have to at least first begin to go back to creating a safe space for us. Safe relationships, start to work on our breath work. One simple one that I want to leave you with today, because this is too important of a topic for me to say we could solve all of this right in 22 minutes. So here's what I want you to do. Begin to work on your breath. The best way to do this is carve out 2-minute breathing sessions per day. Let's call it meditation. Let's call it what it is. We're going to sit quietly, sit on a pillow, sit in a chair, whatever you'd like. All I want you to do, I want to keep this simple. Focus on breathing in through your nose. Breathe in through your nose, and I want you to then breathe out slowly through your mouth. I want you to try to breathe in over 3 seconds, and then I want you to breathe out over 5 seconds. Ideally, I'd like you to breathe into your belly. Okay, so breathe into the lower part of the diaphragm. Don't allow your chest to rise until the end. It should be a belly breath. And you can look up belly breathing. Again, the Cabral Concept podcast is to get you started. It's to get you moving forward. We'll do more talk about breath work in the future, but breathe in for 3 seconds and then out for 5 seconds. When that works, then breathe in for 5 seconds and out for 7 seconds. But remember, the out breath has to be longer than the in breath. If not, you're exciting the nervous system rather than relaxing it. I'm going to keep it at that for today. I hope that this was helpful and at least gets you started for a lot of people out there that are not able to overcome lifelong-based wellness issues, weight gain issues, or trauma-based issues that could be affecting them in terms of anxiety, PTSD, schizophrenia, depression, any type of mental, emotional-based issue that you're currently holding on to right now. Let's work on this together. Again, this is the starting point. Please let me know how I can help. Comment on Instagram, ask at cabralsupportgroup.com. I appreciate you. Thank you so much for being a part of this community and allowing me to speak on a daily basis. Take care.
Did you know that the body really only becomes sick or imbalanced in only 2 ways? Over time, you become deficient in vital nutrients, and you also accumulate toxins internally and from the environment. As those nutrients diminish and you increase your total toxic load, your body then begins to show the first signs of dis-ease. It's actually quite predictable, and the good news is that if we know how you began to fill up that proverbial rain barrel, we also know how to empty it to begin the healing process. I was fortunate enough to learn this ancient healing process from my mentor after suffering from debilitating diseases for close to a decade. It was only when I began to implement these techniques did I finally overcome my illnesses and go on to live a life of energy and vitality that I now enjoy. I'd like to share with you now what I discovered after traveling all over the world and how to combine the best of ancient healing wisdom with state-of-the-art science. Allow me to teach you exactly how I've been able to help over 250,000 people to empty their rain barrel and begin to transform their body and lives into what they've always hoped they could be. To get your copy of the international bestseller, The Rain Barrel Effect, simply go to stephencabral.com/rainbarrel.